Welcome to Medical Dialogues Journal Club. I am Dr. Nandita Mohan. I will be talking about an interesting case report today which is published in the Journal of Clinical Imaging Science, which is published by Scientific Scholar. Cardiac masses are a significant cause of patient morbidity and mortality by virtue of their symptoms and surgical removal. Preoperative diagnosis of a cardiac mass is usually based on clinical correlation and transthoracic echocardiography findings. Myxomas, on the other hand, are the most common benign cardiac tumors commonly occurring in the left atrium, which is attached to the interatrial septum near the fossa ovalis. Although at times atypical location and unusual morphology may pose a diagnostic dilemma with 2D echocardiography, while 3D echocardiography with its multifaceted advantages including multiplanar cropping abilities and superior imaging quality can help distinguish between a clot and a myxoma. Presenting the case report, a 19-year-old male presented with gradually worsening dyspnea on exertion over 2 years with associated complaints of abdominal distension and pedal edema for 12 months. The patient also had a history of atrial fibrillation. Transthoracic echocardiography revealed a dilated right atrium with spontaneous echo contrast, dilated and severely dysfunctional right ventricle, and a sessile solitary mass attached to the right atrium free wall. Valvular pulmonary stenosis was also noted. Taking into consideration the clinical and echo findings, the mass was diagnosed as a thrombus. Low molecular weight heparin therapy was started and the patient was planned for clot removal and pulmonary valvotomy. Intraoperative 2D transesophageal echocardiography, it revealed a 3.5 cm into 3.8 cm echo-dense homogeneous ovoid-shaped sessile and immobile mass which is situated below the superior vena cava on the right atrial free wall, which was suggestive of a thrombus. The 3D echocardiography, on the other hand, confirmed it to be a solitary sessile mass. However, the 3D volume data set analysis showed that the mass had a heterogeneous granular surface texture, few irregular calcifications in the crop plane view, and random small areas of echoluency suggestive of a tumor rather than a thrombus. Surgically excised mass pointed towards it being a myxoma. Hence, the authors concluded that an intracardiac mass should be evaluated taking into consideration the clinical setting, the age of the patient, tumor location, and also echocardiography findings. The 3D transesophageal echocardiography gives us greater imaging quality and additional information, improving the sensitivity and specificity of diagnosis compared to 2D imaging. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.